Welcome back. It's still Mother Care, and I still have with me in the house Dr. Dayo Ajayi. He's a consultant surgeon, and our topic today is on hernia. Thank you so much for being a part of the show today.
A pleasure.
Okay, so this is short. This I can whip it around my tongue. I just don't know much about it. So, first of all, what is
What,
hernia?
anytime you have a part of the inside of the body coming out through the body wall, that's herniation. In other words, the commonest one is bowels.
Yes.
So you can have hernias in adults, you can have in children as well.
Okay.
The one in children is usually due to potential defects. You know, when babies are in the mother's wombs, the umbilical cord comes out. So if that hole doesn't close properly, you can have a hernia coming through there.
Okay.
Or in boys, because when the testicles start off in the tummy and then go into the groin, so there's a potential weakness in the groins. So you can have hernias in children, hernias. The ones in the adults, usually as a result of weakening of the muscles and that's why they're commoner in people who do laborious tasks. People carry heavy weights, or
Alright.
people blow trumpets. People,
Really?
yes, who carry heavy weights.
Okay.
So they're two different things. But the hernia just means part of the body, usually the intestines, popping out through potential weakness.
Okay, so is that when I see pop out, or are there early signs?
No, the commonest signs, the commonest presentation actually is just a painful lump.
Okay.
So pain and swelling, those are the two things. Quite often in adults, I don't know what it is like now, but up till about 30 years ago when I left the country, you can have people coming in with grotesque swellings in the groin, what we call it, and it's a vicious cycle because they're socially aware of it, and they become reckless, they don't want people to see it, and it gets bigger and bigger and bigger. But in the Caucasians, the kind of hernias you deal with are very tiny things, because they present early.
They present early.
Yeah.
Still coming back to early detection. Early detection.
Yes.
Okay, so what's the management or treatment of
I mean, the treatment of hernia is still largely surgical. In other words, you repair the defect. But unlike what we used to do, where we just go there and stitch the hole, so to say, which gives rise to a lot of pain post-operatively, and even the hernia recurs, very commonly recurs, because now you used to tell patients, so don't carry anything or don't do anything for the next 3-4 months. We've gone beyond that.
Okay.
We now have what the mainstay of treatment now is what we call the mesh,
Okay.
which is the easiest way to describe it to you would be like a mosquito net.
Okay.
Yeah, it is like that. It's made of the same material as the stitches we use.
Okay.
So it's like a patch.
All right.
Just patch the hole.
Okay.
If you do, I'm sure you do a lot of needlework.
Yes, so
yeah,
you
just
know.
patch the hole. And that's the beauty, because that's completely tension-free.
Tension. Oh yeah. Because
Yes,
so
there's no
sewing
tension.
it
Yes,
together.
yes.
Okay.
I mean, it's just like if you have a hole in a garment and you stitch it together. If it's under tension, it will give way again. Yes. So it's the patch. And this is like nowadays you can do that through keyhole. But I think either way you repair it, so long as it's a mesh, it does the same thing. So there's little or no chance of it recurring.
Sorry. Okay.
And my patients go back to work. I tell them they can do anything within 2 weeks.
Wow.
And I find most of them, even here or even in Europe when I was there, because I was working in a hernia center, they actually come back and tell me, Doc, I was driving by 5 days.
Wow.
5 days. So tells you how much an
Is it
improvement.
the same solution for the children too?
The children is a different thing entirely.
Okay.
Because in children, remember now what I said, there's a potential weakness in the groin. Quite often you don't have to repair anything. You just find a sac, cut off the sac, and that does it. That does it. Yes.
Okay.
So they're two different things.
They're
even
two
though
different things.
yes.
Okay, now, so the solution really is surgery. There's
It's
nothing
surgery.
else you
It's
can
surgery.
do. Is there anything I do that puts me in danger of this?
Yes. Remember what I said, that people who carry heavy weights, or people
so
with
if I'm
heavy
not
loads,
among that, am I free?
or if you are not a musician, you blow trumpet all the time, or you have chronic cough, asthmatics, chronic cough or chronic bronchitis patients. Those are the things that make you more susceptible to developing hernia.
Okay. All right, so Doc has told us it's surgery, but the beauty of it is that it's
You can do this on a day case basis. You walk in and you walk
and
out.
you walk out, not
Yes.
like before. You know,
Not like before.
when we hear surgery, it's like,
No.
it's a big deal for us. It's a
Yes,
big deal.
yes, yeah.
It's a big deal. But Doc has explained that it's getting to be almost routine. Thank you so much, Doc.
You're welcome.
Thank you for education and of course the solution to it. It's still mother care. You have all your information on hernia now, and I didn't know actually that kids had it. Actually, thought it was just for adults. And whoever thought being a musician could be so dangerous? All the people in church that blow the trumpet and go and find out.
Check the guides.
We'll take a short break. When we come back, it's Doctor on Demand. Your questions are in, and the doctor is waiting for his free consultation.